Okay, so Governor, thank you so much for being here. We have a lot of questions for you, and we appreciate the time. First and foremost, I want to ask you about the pushback to the freeze that we've seen, both from lawmakers, from viewers of ours, everyday people, in some cases from law enforcement. I'll just read you a couple of examples. State Representative Bill Post said it's not just unconstitutional. It's not just that it's unconstitutional. It's not common sense. Clackamas County Chair-elect Tootie Smith has her now famous quote about being treated as second-rate slaves in Oregonians' own homes. The Marion County Sheriff's Office sent out a press release saying we cannot arrest or enforce our way out of the pandemic. So I know you see this as well. What's your, just first reaction to those reactions from people in Oregon?
Look, all of this is irresponsible. These are politicians seeking headlines, not public servants trying to save lives. My top priority as governor is to keep Oregonians healthy and safe. That's where I'm focused. We continue to make decisions based on science and data, and we want to make sure that Oregonians can access healthcare, whether it's hospital beds or a nurse or a doctor when they need it. So that's why we're moving forward with these common sense measures that are based on science and data.
You say that they're public officials. They would argue that they're speaking on behalf of the people they serve, and they're saying these things because that's what they're hearing from the people they serve. So for Oregonians who, based on that logic, do feel that way, what would you say to the citizens who are concerned about these restrictions?
Look, we have too many sporadic cases in Oregon. We can't trace these cases to a particular source. We have to limit gatherings and social interactions. The challenge is that our hospital beds in the Portland metropolitan area are reaching capacity, and our ability of our nurses and doctors and physicians assistants to care for Oregonians is at maximum. These folks, our healthcare workers, have been working day and night to protect and provide healthcare to Oregonians. We are very quickly reaching a limit to that capacity. And it's incumbent upon all of us to limit our social gatherings, slow the spread of the disease, and reduce transmission. We're literally all in this together.
When people hear that law enforcement may be employed to enforce these restrictions, we saw people kind of maybe taking from that any myriad of meanings. In other words, kind of inferring what they might be inclined to infer. Can you just once and for all be very clear about what role law enforcement will play in enforcing this?
Sure. As always, we are taking an education first approach. And the good news is that the vast majority of Oregonians are complying with these measures. However, these measures are enforceable by law, and those who don't enforce these measures put every single one of us at risk. That's unacceptable.
Do you want people calling the police on their neighbors, not emergency lines or 911?
Look, this is no different than what happens if there's a party down the street and it's keeping everyone awake. What do neighbors do? They call law enforcement because it's too noisy. This is just like that. It's like a violation of a noise ordinance.
That could be a yes.
Yes. But honestly, they shouldn't have to. This is about saving lives. And it's about protecting our fellow Oregonians. It's about protecting our families. It's about protecting our vulnerable community members. And frankly, it's about protecting the entire state of Oregon.
Gotcha. The Oregon Health Authority, as I understand it, is still right now having a press conference. And one of the things that they announced was that it sounds like the method they use to tally testing in Oregon is changing. And therefore, the method that they use to calculate the positivity rate in Oregon is changing. A colleague of mine, Pat Doris, did a story on the method that had been used, which, to sum it up very succinctly, basically people who were tested twice, their tests were not counted the second time in large part. Was that the right tactic, and why the shift now?
Oregon is doing a lot of testing. It's an incredibly important part of our strategy to control the virus. We are testing at a rate that is comparable with other states across the country. We certainly increased our lab capacity and funded mobile testing units to ensure that our rural communities and our vulnerable populations have access. We are changing, and both methodologies, let me be really clear, both methodologies are approved by the CDC. We are moving from a person testing strategy to a test counting strategy. And let me just explain it. I now have been tested 3 times, and because of how we've been calculating it, that's only once in the system. And that worked at the beginning of the pandemic. I would argue that it's not the best measure for now. So in my mind, it makes sense for us to be counting and reporting to the public how many tests we're actually doing. That's what we're going to be doing moving forward. And again, both of these systems, both of these methodologies were approved by the CDC. But I also have to be really, really clear. Testing's not the silver bullet. It won't end the pandemic. It is absolutely key that Oregonians continue with the W's: washing your hands, wearing your mask, watching your physical distance. And I'm going to add 2 more. Number 1, get your flu shot. It's incredibly important. And number 2, please, please, please don't go to work when you're sick.
But testing and positivity rates that come from those test counts are key factors in making decisions as far as which phase each county is in, restrictions that are put into place. And based on this shift in the testing protocol, it sounds like the positivity rates have dropped roughly 6 points, according to this press conference. So for people who are looking at this and saying, well, man, when we've been making all these decisions based on these rates, at least in part on these rates, and now we're just going to switch the methodology and they plummet, they may be frustrated by that. So what would you say to that?
I think, you know what, we are 9-10 months into this pandemic. We're all frustrated. I miss seeing my family and friends. I know my fellow Oregonians do as well. I know that Thanksgiving is not going to look like it does in prior years. We had big, huge family gatherings where we ate fabulous food and hung out with friends and family. So I know that everyone is frustrated. I do think that moving to this new methodology makes sense at this time so that we have a better sense of what's happening on the ground.
Why does it make sense now?
Because I will say that we've been criticized for not testing enough, when if you're only counting the person, you don't get an accurate measure of the number of tests that are happening. So for example, as I said, I've been tested 3 times. I'm only counted as once. The comparison with other states is an apples to orange comparison. And I think for the most part, we will now have an orange to orange comparison in terms of the amount of tests we're doing and who we're testing.
Okay, last question for you, because I know we're running out of time. I have 90 seconds. Restrictions on bars and businesses, when we've heard from the OHA multiple times that sort of private events and social gatherings, largely in people's homes, are contributing in large part to the spread. We're shutting down these businesses and bars. What would you say to the owners of those and just people in Oregon who are frustrated and they think, well, it doesn't seem like that's the cause, so why are we leaning into that?
This is really, really hard. There's nothing more than I love than going to my local favorite restaurant. And that's why I looked under every cushion I could to find $55 million for our counties to distribute to their bars and restaurants, their other businesses impacted by these restrictions. But here's the deal. The challenge is that we have way too many sporadic cases. These are cases that we can't trace to a particular source. We have to limit our social interactions and our gatherings in order to reduce the spread and slow the transmission of the disease. There's no other way around it. And it's unfortunate. I am again committed to getting additional resources to our Oregon small businesses. but we are going to need help, and we are going to need help from Congress. We needed it a couple of months ago, but they need to set aside their political differences and do what's right for our businesses across the United States, for our families that are struggling, and for state and local governments.
All right. That was 10 minutes, Governor. That's why that noise went off. I really appreciate your time. I wish I would have muted that.
Great job. Good to see you.
Thank you so much. Thank you, guys.